Well, this week is National Pharmacy Week, and joining me live at the desk today is Bob Fink, the Vice President of Pharmacy Services at U of L Health. Thanks so much for being here, Bob.
Well, thank you, Connie.
I did not know it was National Pharmacy Week.
It is. We're celebrating this week all the work that our pharmacists and pharmacy teams do across the country. Here at U of L Health, we have over 350 pharmacy personnel across our system. They work 24 hours a day, 7 days a week to provide services across our system and all 9 of our hospitals. We have 6 non-oncology infusion centers, 3 oncology infusion centers. We have 5 retail stores, and we have specialty pharmacy, as well as we take care of the prescription benefits for our employees.
Now, that's great news, because you and I were just talking about how many pharmacies around town are closing, or they're not open when they say they're going to be open. Their hours have gone down. What's happening? Well,
Many pharmacies have a shortage of pharmacy personnel, both pharmacies and technicians. Also, during the pandemic, a lot of people shifted their prescriptions from, say, standing in line at the store to mail order. So actually patients are preferring mail order now, and that's changing the model. So many of these stores are closing across the nation.
It's very important, though, to have a local pharmacist that you trust, though, because, you know, we've been doing stories on people like trying to get weight loss drugs and things like that, and they're getting ones that aren't, you know, good quality, and then they're getting sick. So, and that happens with a lot of drugs, right?
Well, hopefully not a lot, but they sometimes take advantage of a shortage. So these particular weight loss drugs are in such high demand, they're on the national shortage list. And the FDA allows certain pharmacies to actually compound a copy of that drug if it's not commercially available. But here in Kentucky, we can't do that. So there are some internet pharmacies available, and that's where the question comes in about the potential quality of those products.
So you mentioned some of the services that U of L offers. If somebody is having trouble with their pharmacy, or they're not open the hours that they used to be, and they wanted to switch pharmacies, how do they do that?
I would say first go to the web page. And for U of L Health, it's uoflhealth.org. But all the hospital systems here in town have pharmacy services available. For example, on our webpage, you can go to the pharmacy site or just search for pharmacy. All of our locations and all the contact information and hours of service appear.
Awesome. Well, thanks so much for being here.
Thank you for having me.
Yeah, we appreciate it. It's so interesting every time we could talk for 30 minutes. I appreciate it.